In honor of Pride Month, we're thankful to have Bethany Snyder here to discuss LGBTQ health equity. Hi, Bethany.
Hi, thanks for having me.
So can you tell us a little bit about what health equity challenges the LGBTQ community face and some of the reasons why?
Sure. LGBTQ people face many different kinds of health challenges. One, because of the systemic inequalities that we face, but then also in relationship to our access to care. So, for example, LGBT people have higher rates of cardiovascular disease, mental health challenges, chronic illness. And many of those things are due to higher rates of obesity, tobacco use, and alcohol use. And some of those reasons are, again, like I mentioned, due to systemic inequality. LGBT people are likely to have lower incomes than and live in poverty than the general population. And this leads to a lack of access to care, lack of access to the employment opportunities. Another thing that I think some people might not recognize is one of the reasons that the LGBTQ community has higher smoking rates and alcohol rates is because of the way that tobacco and alcohol companies have supported, for the lack of a better word, our communities. So you'll see that tobacco companies and alcohol companies will be the sponsors of Pride, will have Pride booths, will provide money to sponsor events at bars. And this leads to a greater usage by LGBT people of those things. Also, those spaces have been considered safe for our community. So whereas we may not have been able to have safe spaces and ability to congregate in other places, that bars were those places where we could come together. And so that all together leads to this, inequities and health disparities in the LGBT.
Yeah, historically, we've seen the tobacco industry target other communities that are priority populations. We talk about them targeting African Americans as though it was deep in our history, but it still goes on today. And this is a community that still faces that targeting from the tobacco industry, and it's still a real problem.
Absolutely.
Can you talk a little bit more about the access to care issues, trust in providers, or feeling comfortable with providers?
Oh, definitely. Access to care is a continual challenge for LGBTQ folks. First of all, just coming out to anyone is sometimes perilous. We're not sure who is going to be an ally and who's going to accept us. And obviously in a healthcare situation, that is even more stressful. There's nothing worse than sitting there vulnerable in a health provider's office and telling them that you're LGBTQ and having having them have a poor reaction. So many LGBTQ folks are challenged with finding a welcoming, open, safe, affirming provider. One of the main ways that we do this is through our own personal networks. I have moved around over the last few years, and one of the first things my family always does when we get to a new community is ask our LGBT people we meet, who's your healthcare provider? Who is your therapist? Who is your pediatrician? And these are the ways in which we are able to find really safe and adequate and affirming healthcare providers.
That really brings up a great question. If you don't have a personal network, where can others in the community go to find good resources and reliable providers?
Yeah, I think most folks should try to connect with their statewide LGBT organization. So in Minnesota, that's Outfront Minnesota has resources, but also the Minnesota Department of Health has some really great resources. The state of Minnesota and folks who live in Minnesota are really lucky to have those resources. Some other states are not as supportive of LGBTQ health. So people in Minnesota have access to those resources.
That's great. And we only have a couple of minutes left, but could you share with us a personal experience that you have that highlight these issues a little bit?
Sure. Just last month, so my partner is a transgender man. He had to have a really simple procedure, scope done where he had to go to a specialist. He had never met the specialist. And I was so anxious on our way to the doctor's office. I was like, are you going to tell them you're LGBT? Well, that wouldn't have nothing to do with his esophagus.
The procedure, yeah.
Yes. I was just so anxious that might come up. And then who knows, they could treat him poorly. And it was really stressful. And it's one of those things that's just undue stress right before someone has to go under anesthesia. Luckily, everyone was caring and great and didn't bat an eye. And so it was a great affirming experience, but we always get kind of that pit in our stomach when we're going to meet a new healthcare provider.
And that added anxiety doesn't help for anybody's mental health and physical health going forward. Bethany, thanks so much for joining us and talking a little bit and sharing a little bit about your experience. This is such an important community for the Heart Association and such an important step going forward for health equity and our work in the community health and the public policy realm about access to care and equitable health access. So thanks so much for sharing with us.
Great, thank you.
And happy Pride Month.
Thank you.